Hello and welcome to Economic Forum, a program where we discuss various issues affecting our economy in Zimbabwe. These can be issues to do with education, to do with science and technology, manufacturing, and many other facets of life. We bring them here to Economic Forum and discuss how they impact our economy. My name is John Masugu. Women's health and wellness is a very topical issue nowadays, quite important that even the First Lady has established clinics to go around the country where women in various capacities can go there and be checked so that they know the state of their health and be treated accordingly, or they change their lifestyles. And today we want to look at that, considering that even government wants no one to be left behind when it comes to such issues like wellness and good health. To help us navigate that topic, we've invited Dr. Bothwell Guzha, who is a gynecological oncologist. You're going to unpack that, but I believe it's to do with a gynecologist who also specializes in treating cancer patients, isn't it?
Yes.
Yes. Welcome to the program.
Thank you. Yeah. Thank you for having me.
Yes. Is it a big issue, like I put it, that women's wellness and health can really affect our economy?
Certainly, it's a very, very big issue, and I agree with you, and this is something that is topical, and I'm happy that you are bringing this to the fore. So, like you've said, introducing me, I'm a gynecological oncologist, and what basically means that I'm a gynecologist who treats women with different types of cancers arising from their genital systems. And I think the commonest cancer that we see in Zimbabwe is cervical cancer. And that's why it's very important that you've brought up what the First Lady has been doing, because cervical cancer is something that is completely preventable. If a woman is screened or tested to see if they've got abnormal cells and they are treated, this is going to prevent them from getting cervical cancer. They will remain very productive to the economy, they will remain very helpful to their families, and this will help Zimbabwe move forward in terms of its economic progress.
Let's look at other challenges that they face besides the cervical or cervical cancer that you talked about, that affect women and ultimately also affect their productivity when it comes to the workplace, even at home.
In Zimbabwe, about 3,000 women get cervical cancer every year. And what I find very shocking is that about 2,000 of these women, which is 2/3, they are dead within 1 year.
And we'll have lost a workforce.
We've lost a workforce. Not just that, these are not women who are dying in their late 70s. On average, a woman gets cervical cancer at the age of 47. So these are women who are still at the peak of their production, not just at workplaces, but also they are the backbone of their families in terms of support and some terms of finances, because they are also working and helping their husbands. So this is really a very, very big issue that probably we'll come back and talk about. Other than that, there are also other gynecological conditions that affect women. For example, in where I work at Parenya, we see a lot of women coming with heavy bleeding because they've got fibroids or other causes. Some of these women, they tell you harrowing stories. They go to work with pampers. Some of them, when the periods are coming, they can't even think about going to work because they're afraid of soiling their seats at work. I was seeing a woman last week who was telling me that she was going to a work conference, and when she wanted to leave the bus, she started pouring, and they had to find ways of not so that other people would not know that's what was happening. So she went out, put on some pampers, cleaned herself, and found ways of coming to clean the seat in the bus. One of the things that I also see is a lot of women with this condition called endometriosis, giving them extreme pain. And I think in our communities we call this JECO. And these are young girls who miss school. These are young women who are still working, who miss a lot of time at work because of pain. So these are a lot of these conditions that actually impact women in terms of their productivity. I want to come back again and not just saying a lot of women that are young are still giving birth. I don't know, Mr. Masuk, whether you know that out of 100,000 women giving birth in Zimbabwe, about 350 of them die in trying to bring a life to this earth. That's a huge number, 350,000. 350 women for every 100,000. And WHO wants this number to be reduced to about 70 in 100,000. So we are losing a lot of women who are still young, very productive, in a process of trying to give birth. So I'm very happy that at least the pleas have been heard, and I think there are actually very big renovations that are being done at Parenya to try and bring it to meet world standards, and hopefully all things will be addressed, and we'll start seeing an improvement. Women living when surviving childbirth and continue to be productive in their everyday lives.
That's Dr. Bothwell Guzha is unpacking some of the problems that are often hidden in society about women's wellness and how that impacts on our economy. And we talk about women right from housewives who look after the family. We talk about professionals, executives, and so on. No one is left behind. So join us in the second segment of Economic Forum. We just learned in the first segment that about 2,000 women die as a result of cervical or cervical cancer, as the doctor put it here, and that's quite a huge number. So today we are discussing women's health and wellness with Dr. Bothwell Guzha, who is a gynecological oncologist. Now, with all these figures and all these frightening statistics that you mentioned in the first segment, let's talk about prevention and education that should go to the people, so that as they grow, as the women grow up to the ages that you say cervical cancer attacks them, there is less of them affected.
That's a very, very interesting question, or something that you want me to elaborate on. So before we talk about prevention, I want to start talk about what causes. I'll come back to cervical cancer because that's an area I'm an expert on. So cervical cancer is caused by a virus called human papilloma virus. I think if you just go on Google and look it up, it's a very common infection that affects 90% of adults. And in most people, it goes away within 2 years of having this infection. So it's a small percentage of women and men who fail to clear this infection. And when they fail to clear this infection, over a period of years, they start developing these abnormal cells. So we've got a very long window to able to pick up these abnormal cells and treat them. That's why I want to come again on the importance of prevention. I want to come again on the importance of Zimbabwe has done very well in terms of preventing cervical cancer. They've set up these clinics in all the provinces and all the districts in Zimbabwe. And I think the First Lady has gone out to make it even more prominent to bring this issue to the fore. But what I want to tell you again, that is very, very surprising. Only 20% of women actually go and get screened. With all this
Despite this publicity,
only 20% of women actually get screened. That means 80% of women are walking around probably with abnormal cells, and they don't get an opportunity to be treated to prevent cervical cancer. And having missed that period to being screened and to prevent cervical cancer, how do these women now present to hospital? They now present with vaginal bleeding, they now present with a very offensive discharge, and they sometimes now present with pain, they now present with a lot of other problems. And what's said, I want to come back to this is completely preventable. No woman has to come to this stage that I'm describing now. What I find even more harrowing is when these women now they're told that they've got cervical cancer. You make an appointment to see them to make some investigations. You don't see them for 6 months. and you try phoning them, you try a lot of things. You know what, where they go to? They seek other methods of treatment. And the commonest that we see nowadays is they go herbal treatment. But what I want to say is that herbal treatment is not free. Some of these women, they go out of their way, they are selling their house possessions, they are selling their livestock to try and buy these herbal treatments to no avail. By the time that they come back to hospital, because the herbal treatment hasn't worked, they are now with very, very advanced disease. I just want to say, if a woman is screening for cervical cancer in Zimbabwe, is completely free. The Ministry of Health and the government has made screening free in conjunction with the partners that they work with. The treatment to remove the abnormal cells is completely free. So it's you presenting to the clinic, getting screened, you don't pay a cent, getting treated, you don't pay a cent. But once you have a diagnosis of cancer has now been made, you now need to get a lot of blood tests done to see whether you've got enough blood, your kidneys are working properly, your liver is working properly. That's money that is already being spent, that could have been spent on other areas in the healthcare sector. You start getting these very advanced scans done. You probably need a CT scan or an MRI scan. You need these chest X-rays, these ultrasound scans. Those are very, very costly tests. And on top of that, you then need the actual treatment. If you present early, you need to have surgery done. If you present with advanced disease, then you need to have a treatment with a combination of chemotherapy and radiotherapy. So on one hand, preventing was going to cost nothing at all to this woman because the government fully funds this screening and treatment. On the other hand, when now you've got cervical cancer, then this is now a huge cost to the fiscus, a huge cost to the patient themselves, to the woman herself and their family, because a lot of some of these treatments now, they have to get money out of their own pockets to fund them. So we now get to a stage where instead of having been very productive, looking after your family, going to work, supporting your husband, supporting the economy, you now spend a lot of time queuing in hospitals, getting money out of your pockets to get these treatments. And when these treatments, they also come with some side effects that might sideline you from being productive for months. And when you recover, you need to be followed up to make sure that the cancer is not coming back. So I want to come back and really encourage or advise every woman to get screened to prevent cervical cancer. You are not doing it. You are doing it for yourself. You are also doing it for the nation.
While you advise our women folk, what is it that you advise society? Because what also happens, why they are not going there, is because of the reaction of others, men, friends, peers, and so forth. And as a result, people shy away. I think it's very important, doctor, that you also appeal to the support of workmates and family.
One of the things that I want to try and we should destigmatize is the link between HPV and cervical cancer. So every woman, if they think that there's a problem that is split, they think, oh, maybe she's promiscuous. And so what I'm going to tell my friends, what I'm going to tell my husband. I think we need to do more health education, not just to these women, but to men as well, so that the women get a lot of support to go for screening. So that's a very, very important point, because women really need to be supported to go through the screening program and treatment.
When we get into the third and final segment of Economic Forum, we shall also look at how we can help each other at workplaces and at home, as he has already hinted, so that all of us feel free to be treated, so that all of us are included in some of these programs that government is initiating in order for us to be a health nation. So join us in the third and final segment of Economic Forum. We are now in the third and final segment of Economic Forum, where today we are discussing women's health and wellness with Dr. Bothwell Guzha here, who has actually enlightened us on a number of issues. When we discuss these issues, Dr. Guzha, I think it's important to start at the girl-child level. There are certain challenges that the girl children face which affect them in future. Issues to do with the pads, issues to do with being abused and so forth. You talk to us about that and what you meet when you go around in the hospitals.
It's important to pay attention to the girl child. They go through a lot of things that we can actually prevent. So some of these girls, when they start having their periods, sometimes their periods are heavier than what happens as they grow older. So we get them being admitted in hospitals, being treated for anemia, that means they've missed school, and a lot of other things. And then we get this condition called endometriosis, which normally causes extremely painful periods. These children are told that, I've got JECO. They said, I can't go to school today because I'm in a lot of pain. And nobody believes them. So they are really, really suffering in silence. So there are a lot of these gynecological conditions, these conditions that these girls go through that need us to pay a bit more attention. On a positive note, I want to say that one of the things that is now very, very important, WHO is talking about eliminating cervical cancer as a public health problem in the next 100 years. And one of
it might seem too long.
It may seem too long.
Yes.
But there are some targets that we need to meet by 2030.
Yes.
So now the good news that I want to tell viewers is that cervical cancer can be prevented by a vaccine. This vaccine is given, now it can be given as one dose, and it's given to girls when they're still in primary school. The government of Zimbabwe started vaccinating girls around 2018. So if you've got a child at home, please make sure that they were vaccinated. And WHO recommends 90% of the girls to be vaccinated. And I'm very happy that Zimbabwe is doing very well on that front. And I think what we're going to see a lot of economic benefits in the future. These are young girls who are not going to have this abnormal cell that I was talking about. These are young girls that are going to be prevented from having cancer. These are young girls that are going to be prevented from having early death from cervical cancer. So I think this is going to make such a big impact to our economy. Then the other thing that I want to discuss about as well is that there are other cancers that can be prevented. It's not just cervical cancer, which I'm passionate about, and there's also breast cancer. We are getting women having breast cancer at younger ages, and this is also preventable by screening. And there's also colorectal cancer, which is also preventable by getting screened with colonoscopies. For breast, you just get a special type of an X-ray or a scan where they look for these tiny lumps before you even feel anything in your breast. You are treated, and you have got very good chances of survival. So what I want to encourage people is to discuss these issues freely. There are these bosses at work if you're employing a woman and she fails to come to work on 2 or 3 times, please take an opportunity to talk to them.
Or even if they are moody.
Yes. Yeah. Please take an opportunity. You don't know what they are going through. Maybe they've been to a clinic, they've told that they've got abnormal cells, they're afraid that, oh my God, I've got this 3 years, I've got my youngest born is 3 years, I'm going to die from this dreadful disease. Please take a time to understand. One of these conditions that I want really maybe to also talk about is a condition called endometriosis, where basically you get women during the time of their menses bleeding into their tummy, and this causes them excruciating pain. So they've got pain all the time. Their periods can be heavy, but they are very, very painful. No one believes them. So when they miss work, when they're in a lot of pain, people think that they are lying, they are faking illness. And so I want people to be more empathetic, especially at workplaces. So I wish there was a way that all these discussions can be done openly. in the workplaces to try and encourage women with problems to come forward, to encourage women to get screened and try and prevent some of these things that I've talked about.
How much do you share with the management that you've alluded to, that they have to understand women, especially those in charge of welfare in human resources and so forth, so that at the workplace where women spend most of their time, and also let's not forget those who are in outlying communities, we often forget, yet they work so hard in the fields and other spaces. How much are you doing some outreach programs over and above what am I, the First Lady, is doing?
So you've actually challenged me, and I think we'll take up the challenge
With your colleagues?
With my colleagues, because I think and more doctors should be doing this, going to workplaces, doing some seminars, coming on TV, talking about these problems, and try even going to men's forums and talking about these problems, because most of these bosses at work, they are men, and they don't understand. They want work to be done on time. They're looking at whether the company is making a profit or is making a loss, but without paying too much attention to those women that are suffering, trying to make the companies being productive. So I think it's a challenge that we will take, try and spread this message so that people are a bit more empathetic, especially. What I've learned as a doctor is that women understand their bodies more than anyone else. So if she's telling you that there's a problem, 99% of the times there is a problem, and our role maybe as managers and as doctors is to say what is the problem and how can we assist.
In a very short space of time, how are our medical insurances taking care of women's health and wellness? Very briefly.
I think medical insurances can do a lot more, because some of the medical insurances, they don't pay for screening. For example, I said, so women that are on medical insurance, like I said, you can prevent cervical cancer by doing the VIAC test, by doing pap smears. They pay very little amounts. So, and there are other conditions like diabetes, like hypertension. So I think medical aids should focus more on preventing these conditions, making way to prevent women from getting cervical cancer, working more for wellness programs to prevent women from getting diabetes, rather than waiting until the problem has arisen and then now to pump out more money for treatment. I think somebody said that prevention is better than cure, and I totally agree with that, and I think that medical aid society should be emphasizing more or paying more for preventive programs.
Well, Dr. Guzha, I would like to thank you very much for coming and giving such valuable education. That's Dr. Bothwell Guzha, who is a gynecological oncologist, was talking about women's health and wellness, and touched on many things, and prevention is better than cure, as he said. If you have any questions that you would like to ask, you can do that on the numbers that are showing on your screen. If you also want to engage with us, you can do that on the social media platforms that are showing, and you can invite Dr. Guzha here and colleagues to explain what you will have not fully understood. On behalf of Dr. Bothwell Guzha and the production team of Economic Forum, this is John Masugu wishing you happy viewing.